Hello, everybody. Hello. I look a little rough. I look a little rough. How is everyone? Welcome. Come on in. Can you guys hear and see me okay? Long time no see. Hi, Jennifer. Hi, Jeff. Hi, Steph. Hi, Sally. You guys, it's been so long. And I got to tell you, all of my regulars, you guys know I get like migraines and stuff. And I haven't had a migraine in like months, but right now, today, I have one. So I'm going to see how long I can last here. Wes McFadden, you seem new to the group, and we have the same last name. So where are you from and welcome. Hi, David C. I did visit Montana last week. I was in Bozeman, Montana. Hi, Rita. Hi, Precious. Hi, Julie, teacher, Charlotte, Donna, Catherine, Mike. You guys, I feel like a bunch of regulars are here. I love it. If you've seen me rubbing my neck, that's why. It's because I kind of hurt. Hi, Jill. Hi, Megan. Lori, Edith. Just saying hi to everybody. Hey, Peter. Me and Kramer tuned in. Oh my gosh, missed you guys. Have I seen any shadow figures? No, I don't see any like scary things. You said possible angels. I do think I've seen an angel once. I'm not going to tell the story because I kind of always do, but there's a bunch of videos about it on my YouTube channel. You can always go to my channel, Hospice Nurse Julie, and you'll see my angel video. Hey, Terry. Thanks for watching my videos. Hey, Lindsay Clark. She's a newbie from Scotland. Welcome. Hey, Steve. I missed you too. Oh, Sharon, I'm so glad you're here. I'm so sorry about your husband. Welcome, guys. Ethan, you saw me on Dr. Phil. Yeah, I was on Dr. Phil quite a long time ago. And I'm not necessarily a huge fan of Dr. Phil. I hate to say that, but he did really help out my book sales. P.S. My journal is officially out. You can get it now. Nothing to Fear journal. I'm sure some of you already have it. It goes along with my book, but you don't have to have my book to have it be useful. How do I feel about the death with dignity laws? I'm all for it. I live in California where it's legal. Death with dignity is basically an ability to end your own life if you meet criteria. Criteria, generally speaking, is usually less than 6 months to live. 2 doctors claiming that you have no mental health issues, and then that you can physically take the medication yourself. So yes, I'm all for it. I've seen several people do it. Thank you, Megan. I know. Like, yeah, the Dr. Phil thing. It's hard. It's like I did it because the show was a really great topic. My friend was going to be on it with me. And I got to say, Dr. Phil really did me a solid. And he was like holding my book up and being like, nothing to fear, her book, her book, her book. So like it really did help with book sales. I'm sitting with my Darlene says, I'm sitting with my mom who's in her last hours. Your videos have helped me so much. Oh, Darlene, we're sending you so much love, honey, and thank you for being there for your mom. Welcome, everybody. Come on in. I'm just reading the comments and answering questions best I can. I don't know if I told you, if you see me like rubbing my head or rubbing my shoulders or ears, it's because I have a pretty bad migraine. I haven't had a migraine in a very long time. Hello from Fargo, North Dakota. Very cool. Deborah's new to live. Welcome. Migraines are miserable. I know. I had new migraine medication that has worked really, really well. So fingers crossed it still works. Welcome, everybody. I am thinking about, all of my regulars know this. I've been kind of in and out of coming here every Thursday. I'm really thinking about maybe just doing it once a month. That every week has been pretty rough. So maybe if I make it consistently like the last Wednesday or Thursday of every month or something. I don't know. I still haven't figured it out, but does death weigh on you heavily? Does it happen often? Well, yes, all of our patients die on hospice. It doesn't totally weigh heavily on me because I've definitely gotten to a place where I understand that everyone dies. And I feel like if you're dying on hospice, if we can give you a good, peaceful death, then we're doing a good job. So, death to me is not the worst possible answer or worst possible thing. Suffering is far worse to me. Thank you, Miss Franco. Alicia, thank you. Just wanted to say thank you, Nurse Julie, because you've made my death positive, and living with lupus isn't hard. And living with lupus isn't death positive, and living with lupus isn't hard. Thanks to you. Love and respect from Southern California. I'm in Southern California too. I'm in Santa Monica. Did you know that? Kitty, thank you. Kitty says, welcome to all the new people. Hit the heart. Yeah, thank you. The bottom right heart helps me. Jeff says, Miss Julie, what have you been doing? Wait, see, I can't even freaking read. What you have been doing is giving people hope that we survive death. If you knew of something that could replace that hope with absolute certainty, would you tell your viewers about it? I would if it was a certain fact. I wouldn't if it was a belief. Like if I have a belief system that like you survive death because you go on after this, right? That's a belief system. I wouldn't ever try to force someone to believe that. But if there was like a magic pill that somehow could make us live forever and it was legit and not a scam, I guess I would. But I'd be quite skeptical. Am I desensitized? Probably a little bit. Desensitized a little, but for the most part, I think I'm more just realistic. And I've seen the opposite of hospice, which is I worked in the ICU for many years, where all we did was try to keep people alive. And because of that, I was like, ugh, this does not feel good. I don't like trying to keep people alive at all costs. There has to be a better way. So, to me, again, death isn't the worst possible answer. Do you think our loved ones hear us as they are dying? Yes, we actually do really think that. There's been EEGs done on the brain. Hearing is the last sense to go. The hearing center of the brain doesn't shut down until the person is fully dead. So we do think that. Oh, thank you, Jen. Jen says, thank you for sharing your knowledge, your videos, and the perfect timing of the release of the book last June helped me better for my mom's final days. Oh, thank you, Jen. It's still really hard. I know, I'm sure. Oh, Julie, thank you. Julie says, the story you told about that guy dying and you feeling it in your head has helped me believe that my father is in a better place. Yes, if anyone's interested in that, there's also a video. I think it's labeled like why I don't fear death. If you want to look at that on my page. Sorry, I'm just reading through things. Lindsay says, love your content. Didn't know you had a book. Oh, thank you. Well, yeah, I kind of forget to mention it. You guys made it a New York Times bestseller. The camera's opposite. You guys made a New York Times bestseller, and I have a book. And now, just June 17th, my workbook came out, my journal that goes along with the book. Available wherever you want to get your books. You can also just go to hospicenursejulie.com, and that'll show you where to get it. Have you read Stanford Betty's work? No, I haven't, but I'd be into it. I'm sure I should look into it. Jeff, would you like for I would like for you, oh my gosh, why do I have such a hard time reading Jeff's things? I'm so sorry, Jeff. What I would like for you to do, Miss Julie, okay, here we go, is read the 9.5 thesis and decide for yourself if it proves the existence of souls. If you agree it does, I ask for you to recommend it, Jeff. Jeff, I can only just being super honest. One, I totally appreciate you being here, and congratulations on writing and all of your beliefs. Just to be super transparent, I am so bad at reading things. I will watch all types of things, but reading things, not so much. And unless there's real scientific proof, I still believe it's just a belief, which again is like beliefs are really strong. I have my own beliefs. So, but more power to you, Jeff, for real. More power to you. And if anyone else is interested, I think it's called the 9.5 thesis. Jeff, I think you said it's on Amazon. Sharon just asked, is your book on Amazon? My book is on Amazon, yes. Jeff's book might also be on Amazon. My book is on Amazon. Jeff's book is on Amazon. And Nothing to Fear Journal is on Amazon. Yes, and many people in the chat, Jeff, sounds like they're interested too. Hey, Jim, welcome. It's Jim's first time here. Tina, hi. My spouse has stage 4 lung cancer. I've given him your book and workbook. Oh, Tina, seriously, that makes my heart melt. Thank you. Thank you for your work. He's not near death, but your content has greatly helped us both. That's amazing, Tina. That's like what makes me so happy is hearing that my content has helped people. Oh my gosh, Kitty, I love you. Kitty says, welcome, Jim. Prepare to be addicted. Yeah, Jim, we have a really good community here. A lot of the same people come back every week. First time catching a live too, finally, but I've watched quite a bit of your videos. Shannon, welcome. Actually, this is like making my head feel better, which makes me feel like it's all in my head. Why does distraction make my head feel better? What the hell does that mean about me? Hey, Janet, joining from Ottawa. Welcome, everybody. Wes McFadden, same last name. Has any of your patients seen pets that have died? Yes, Wes. Many people have seen their pets that have died before they die. It's definitely a common thing. It's part of visioning. People not only just see dead relatives and dead loved ones, they see dead pets. They do. Not everyone, but of course people do. Hello, Mary Waite. Welcome. Welcome, everybody. Come on in. We just started the live about 12 minutes ago. Headaches from tension, perhaps vasoconstriction. Yep, could be very true. Sarah Lee says, I don't believe there's anything after death, at least not like we picture it. I know what you mean, Sarah. Really. I mean, I do think there is, but I don't know if it's going to be like how we picture it. You're right. And also, like, I love living in a world where, like, I don't have to be in the black and white. I don't have to know for sure and say I'm right. You know, I can say, I don't know. I think so. This is what I believe. And then other people can go, I am sure this is what I believe. And then someone else can go, I am definitely sure nothing exists. And this is what I believe. I think it's all important that we are allowed to have our own beliefs. And I never want to sit here and try to preach to anybody. Yay, Sandra. I'm a new death doula because of watching your videos starting on TikTok. Oh, that's amazing. Sorry, I'm just looking through the questions. Thanks to everyone saying thank you. And I love that everyone talks to each other in the comments. Or like to each other in the chat. That's amazing. The man I take care of with end-stage renal disease has fluctuating BPs. No, that's not indicating near death. I wouldn't even really focus on blood pressure. Someone who is on hospice with end-stage renal disease, if they like literally stopped dialysis and then went on hospice, their death is pretty, it's like pretty easy to clock. It's usually 7 to 10 days from stopping dialysis usually. But if someone's in end stage renal disease and is not on hospice or anything, I wouldn't go by blood pressure. I wouldn't go by anything really. I just take it a day at a time, look to see if like how often they're peeing, if they're peeing at all, if they're sleeping more than they're awake. There's other things you could look for. Hi, Abigail. What can we tell super atheist people to make them not be afraid? How I do it is I just tell them how normal it is to be afraid. Normalize that fear of something so wildly unknown is really normal. And I always say, like, welcome to the club. People are afraid of end of life. And sometimes just saying that does not like fully take their fear away, but it makes it almost a little lighter, like almost like they fear the fear, or they're like ashamed that they have fear. It's like, no, it's okay. Of course you have fear. And it's really, really normal to have fear. And like, what does that mean to you? What what do you think? And I would kind of go from there and not really try to force anything or go, you don't need to be afraid. Don't be afraid. It's sort of like, I get it. Of course. It's the unknown. It's the great unknown. And like, what if you're wrong? What if, and not because they are, but just like the whole, like, what if questions. And at the end of the day, we're not therapists, right? Nurses are not therapists. That's not our job. So you could always have them talk to the social worker, the chaplain, because chaplains are not religious. They're just like spiritual people talking to other spiritual people, or not, even if they're non-spiritual, right? So I usually just first thing I do is just try to normalize their fear. Brian, welcome. We're glad you're here, honey. Karen Ross, how do hospice teams respond when the patient's DPOA says no meds for patient's restlessness agitation, but staff know the patient will be better served with some medication? Sent to ethics committee. Yeah, Karen, that's what we would do. So if a DPOA is refusing to medicate someone who clearly needs medication, ethics committee needs to be brought in, and the patient needs to be removed from that level of care from the patient, because it's patient neglect. We can't do that, but it takes a long time. So that's hard. In the meantime, the patient suffers. Hey, Jeremy, thank you for the $20. You have a hard job, Julie. Go do something special for yourself. You deserve it. Oh my gosh. Thank you. Thank you. Thank you. Thank you. I consider myself pretty atheist. I think I'm afraid of death only because I don't know what to expect, but I'm equally as fearful as a Christian. Yeah. So the thing that I think about is, like, if I'm wrong, that there isn't anything after, like, of course I want there to be something, right? I would love that. I would love there to be something after we die, something more beautiful than here ever could be, right? But think about, let's see, I was born in 1982. Okay. So let me think about 1972. What was I feeling? What was I thinking? Did it feel scary? Did it feel like I was in a black abyss of nothingness? No. No, it didn't. It felt like that no existence was no existence. There was no fear there. There was no agony there. There's nothing there. And of course, we have existence and consciousness now, so that feels scary. But when you don't have it, it's not scary. And we all already know that, because we all have been in a time when we weren't born. Does that make sense? Again, like, I don't want that. I don't want that to be the truth. But also, like, in 1972, when I was not alive, that wasn't scary. You know what I mean, Jelly Bean? Does that make sense to people? What are your guys' thoughts on that? Does that make you more scared? Some people say it makes them more scared. I think it makes me less scared. Is it wrong to feel relieved after the end, that that the end was? Yes. No, it's not wrong. So many people feel that way. So many people feel like relief and then guilt for feeling relief, but that's a very common thing. Oh, what if I'm wrong and there's a God? Then I assume he would be loving God and there wouldn't be a hell. Yeah, to me, there isn't a hell. I just don't believe in that. Like no matter what, I just don't think there is. But I realize that many people do. But I just don't, no matter what. Oh, Ethan, my question was, think about think before, like, okay, I was born in 1982, right? So if I think about not being born, like when I was not born, 1972, nothing about that feels scary because I had no existence then, right? So, um, what if death was like that? It's like it's not scary because you're not conscious. Like we think it's going to be like this, so it's going to be like a dark nothingness, but not really because once you're not conscious, you're not conscious. Does that make you more scared or less scared? I don't know. I know, Jeff, but here's the thing, honey. Um, that's just your belief. I don't care if you say you've proven it. I don't believe you. No offense. Truly, honestly, I'm truly not trying to offend you. I hope I'm not. But what you're saying, yes, you have a very strong belief, and that's amazing. So that is just a belief. Why the hell would any doctor deny a dying person medicine? I don't think they mean doctor, Sarah. I think they mean DPOA, which is the person who makes decisions for the person who can no longer make decisions. Welcome, everybody. Come on in. Hi, everybody. Come on in. POA or DPOA is the power of attorney over somebody, meaning like if someone has dementia and can no longer make decisions, they assign someone, the person who does have a good cognitive ability to make decisions for them. Thank you, Maria. Welcome, everybody. Come on in. Hospice Nurse Julie here. On the bottom right-hand corner of this live, there's like a little heart thing you can press, and that does help the live. Welcome, everyone. What's your take on psychedelics? Do you think it helps the fear of death? There's been studies that show that it does. I'm personally sober, so I would not take psychedelics, but doesn't mean someone else can't. And there has been some studies to show that it can help. Welcome, everybody. Come on in. I'm thinking about possibly making this live once a month. I know you guys might not like that, but what do you think if I made it once a month and then like really was consistently there? Because I feel like right now I'm not consistent with the once a week. So maybe if I do it once a month, it'd be a little easier. And I get a few more people because I can plan for it a little better. Phyllis, I think palliative care is amazing. There's no downside. You should definitely do it. Thank you so much, HR. Ease us into every other week. Oh my God, Kitty, I love you. Maybe every 2 weeks, Sally says, yeah. Well, I'll keep you guys posted before I do it. Before I do it, I'll keep you guys posted. Hi, Julie, maybe twice a month. I need to do a better job at telling people about it. How painful the death could be from dying from aspiration pneumonia? Not necessarily painful. Basically an infection, so it doesn't necessarily mean it's painful. I would have to like kind of know more about the situation, but I wouldn't necessarily say it's a painful way to die. Yeah, that's why I kind of think too that if we did it once a month, it would be a lot like people could prepare their questions, a lot to think about over the next month, but maybe it can go down to twice a week. I'll keep you posted. Again, I'm not going to do anything. I'm not here next week because I'll be in Baltimore, Maryland, but then I'll be here the next 2 weeks in July. I know Charlotte said I'd be afraid every 2 weeks I'd get confused. Like which week is it? Same. And it's my live. Reminder, I have to hit notify for each live. Other videos pop up. Yeah, but not the lives. Yeah, the lives you have to there's a button where you can get notified. Any tips on dealing with grief? I lost my fiance in 2019, lost 2 laboratories last summer. Oh, Jessica, it's so hard. Any kind of advice I give is truly just human to human advice because I'm not, licensed counselor or licensed therapist. So to me, grief is just like a roller coaster and it's weird. I was just talking to my bestie today and I was asking her how she was doing because her dad just died a few years ago. And she just said, grief is weird. I can avoid it sometimes. And then all of a sudden it hits me. And then I realize I'm avoiding it. And then I'm like down for the count. So I think it's just up and down, up and down. Generally speaking, in life, I feel like we isolate when we're sad and alone. When we feel sad and alone. But I think generally speaking, I think we need connection despite how much that sounds like a bad idea. So I always think support groups of people who are grieving is a good idea, and reaching out to people when you're not feeling well. However, the general public is not good about talking about grief or dealing with someone who has grief. So I would probably only reach out to people who also have suffered some kind of loss to talk about it. But I think a support group is always a really good idea. As awkward as that sounds at first, I think you'd really like it. I have a 12-step program that I go to all the time, and that kind of stuff really helps me. I always feel so grateful that I have that. And then I also think therapy. Yeah. Hold on 1 second. Let me go back to Jason. She was kept asleep most of the time. Hold on, Jason. Hi, my girlfriend died July 14th. She was only 42. She got a new strain of COVID, was always weak immune system. She had given morphine, propofol, all of her organs failed. Oh, she was kept asleep. She was getting fluid suctioned out of her belly. 9-inch needle. So that's probably ascites, Jason. When someone has a failing liver, they get ascites and it's in their stomach and they get it aspirated and it's a little needle. It's called paracentesis. Very normal, but it's hard to watch. Oh, I'm sorry, Jason. That's so hard. So hard. Did I answer your question though? I don't know. But yeah, it was likely to do with her organs. I mean, I don't really know, honestly. I don't always just listen to a girl on the internet. I mean, I am a healthcare professional, but obviously I'm just going by what you're telling me. What it sounds like is she must have been in multi-organ failure, and that means her liver was failing, which means ascites, fluid will build up in the abdomen, and then you have to do a paracentesis and drain it, which is a large needle in the abdomen, and it's just fluid coming off, and it will build back up. But it's really, really hard. I'm so sorry. What am I doing in Baltimore? My besties are there. So I lived in Baltimore for many years before I moved to California, and my besties still live there. So I go see them. And they have 2 children. They both have 2 boys. So yeah, she also had a liver transplant 7 years ago. That's probably what it was. Yes. Have you gotten Julie's journal yet? Megan, you're so good. Yes, my journal is officially out, guys. The Nothing to Fear journal, which goes along with my best New York Times bestselling book, thanks to you guys, has been out for a year. The Nothing to Fear book, the journal. Yay! You can get it at hospicenursejulie.com or basically anywhere you want to get books. Amazon, Target, anywhere. Oh, Diane, I'm so sorry. Thank you for being here. I'm so sorry you're feeling that way. It's so hard. Oh, Robert, thank you for being there for your wife. Oh, Robert, he says, okay, so he was able to lay in the hospital bed with his wife until she passed. Grief support group along with 12-step program helped a lot. Oh, Robert, thank you for sharing. That's so glad you had those two groups. Were you nursing in Baltimore? I was trained at Johns Hopkins. Me too. I was nursing. That's where not all of my ICU experience, but a lot of my ICU experience was at Johns Hopkins. Yes. My dad is passing away from CHF, which is congestive heart failure. He's refusing home health and hospice. He acts like he has dementia, but very much in denial. I don't know what to do. Justin, if he is alert and oriented and can make his own choices, you can't do much. But you could always, if he lets you, you could always try to go to his doctor's appointments with him and get you and the doctor to talk to him, kind of figure out why he is so afraid of it. Also, if he really does have dementia, then you can maybe turn into his DPOA, the person who, makes decisions for him, and then maybe be able to get the care that he needs. But at the end of the day, if he's alert and oriented, he has to make his own choices. Hi, Julie. I wish your books were being sold at Walmart. Mark, I think they could be. I'm not sure about the journal, but I bet my book would be. You could check. Or maybe you already checked and you couldn't find them. Like you'd have to do it online. Definitely not. They're definitely not in store, but you might be able to find them online at Walmart. Oh, Jim. Jim says, I'm an only child. I deal with almost everything myself, but now dealing with my dying mom, I can't deal with asking for help. Oh, Jim, is there any way we can convince you otherwise? Trying to get more help, honey. If you can financially, get more help. Like pay someone to do it if you can. If you can't financially, which most people can't, I get it. But that's one of the biggest things I always say. Bye, Ethan. One thing I always say is you have to practice asking for help, because at the end of life, when someone's at the end of life, if you're the caregiver or if you're the person who's at the end of life, you're going to need help. Oh, Tia from Pittsburgh. Hello. Bye, Kitty Cole. Megan just said you can get it at Walmart, but you have to get it online. Oh, thanks, Jason. Glad you're here. Hey, Mark. Oh, thank you. The universe is more. I studied to be an end-of-life doula, so appreciate all the information you gave us. Just wanted to be comfort like the hospice nurse was for us. Oh, thank you. And thank you for the $5. It's always so flattering when people give me money. Thank you so much. Debbie K. Hi again, honey. You take care of the 106-year-old. She's still going on. Wow. Yeah, support groups have helped me so much. I know. Yes, yes, yes. Martin, I can't really answer that question about the trach. Seems too much like medical advice. Good night, Angela. Thank you for listening to me. Listen, it's only been a half an hour, you guys, but I do have a headache and I'm not feeling the greatest. So I think I'm going to head out early, but I'm not here next week. But the last 2 Thursdays in July, I'll be here, and I'll try to advertise a little more so I can remind you guys to pop on if you want to. If I didn't answer your question, go watch more of my videos. A lot of my videos will probably answer your question. My journal is out now. Thank you for everyone who's purchased it already. And my book has been out for a year, and you guys made it best New York Times bestseller. Thank you. Thank you. Thank you. And I won't see you next week, but the next week. And I love you guys, really. Such a great group. Such a great group. And thank you for being so understanding. Love you. Bye, guys.